I had tongue cancer. I've had getting on for half my tongue removed and replaced with the skin from my arm, which I have a skin graft. I had to have a tracheostomy, and my operation was, I think, 11 and a half hours of surgery. So it was a big op. I think I was so focused on, right, I'm going to have this operation. That was my main focus. I need to get through that I didn't really think about what I was going through. I couldn't speak for, well, not quite a week, but getting on for that time. That was probably the hardest thing for me because I couldn't express myself. A couple of days or so after the operation, it really hit me how hard it was. I'd written down all these feelings that I had, like just feeling very alone and scared. So this was why I thought I need some sort of support, because I know that even after hospital this isn't going to go away. This is something that has now triggered something inside of me. And they suggested that I spoke to my nurse about it. And then obviously I had to wait till I came out of hospital to be able to see Sanchia. The service was really good because when I came out of hospital it wasn't that long that I had to wait for an appointment. For me, it's been really, really supportive. I don't think I'd be where I am now if it wasn't for the service. Well, we've mostly talked through what had happened like in the weeks before I saw her. But also she gave me a booklet about health anxiety and asked me to read through it and then write some things down. I thought, well, I'm not sure about this, I'd rather just sit and talk to Sanchia. But I thought, no, I'll give it a go. And what was interesting was when I started to read it, I was like, well, this is me. You're talking about me here. And everything in it, I was like, well, I do that. It was interesting to see how it's not just me doing that. There's obviously lots of people out there that are doing the same thing. And I think I'm not around a lot of people that have had cancer. It was interesting to think how other people are coping with it, because even though I'd got support and everything from family, I just felt like they perhaps don't always understand how I'm feeling and what I'm going through. And that's what Sanchia said, it's normal to feel this way. And I think that was a big thing for me. I think the biggest thing that the therapy has given me is I'm still anxious, don't get me wrong. I suffer with health anxiety now. You need to let it be there, allow it to be there, instead of always trying to fight it and push it away, which is what I do. I've got to think, yes, I'm anxious. Why am I anxious? And in a sense, talk myself through it. So at first, when I started my sessions, I was very irrational. There had been a couple of times, for example, I had a lymph node that came up on the back of my neck, and that sent me into a massive panic. But as time went on and I'd spoken to my consultant and she reassured me that everything was fine, I was able to rationalise things a bit more. Your mind is all over the place and you're not coping very well. You can't think like that, but I'm getting better at being able to do that by thinking I'm having an anxiety attack here. I'm recognising that I'm doing that. Yeah, that was a big thing to be able to do. I still get thoughts that come through like, something bad could happen to you. Like I say, that's always there, but I'm able to deal with it a lot better with the strategies that Sanchia has given me. I'm able to do things in my life that I did before the cancer, like I'm back at work. I do see friends. I've raised money for the hospital as part of my way of saying thank you. And I have changed my whole sort of outlook on how I look after myself. I'm a bit better at maybe exercising a bit more and eating a little bit better. So it's really positive in that sense. And I don't mean to sound corny when I say this, but I was a bit like, I feel like I've been given a second chance and I don't want to be this person that's not willing to kind of make some changes to better myself and feel better in myself. So I think it's really good to know that there's so much out there that's so supportive, and you're not on your own after it, and that's a massive thing really. So I would say definitely give it a go. Even if you think, oh, it's not for me, you won't know until you try. To me, it is just about just being able to feel, just to feel comfortable to express everything that I'm feeling. You know, that's quite a big thing, because sometimes you think, if I say that, do I sound stupid? Don't think that is what I want to say, because nothing you say is stupid, because it's how you feel, and you know, feelings aren't stupid. I think it will really help you get through, you know, the difficulties that you have after having cancer or going through cancer. I'm able to cope with things daily now that I wasn't able to cope with before. And some of that is a time thing. It does take time to heal after something, but I think I've achieved quite a lot in a short space of time. It's only been 8 months since I had my operation. I can see little changes each day which are positive, and that's with help from the service I've received.